Thank you so much for joining me today. Today we're going to be doing some extra points from the acupuncture meridians. Essentially, I was supposed to learn these points last year for school, but because of the pandemic, everything got pushed a little later, and I'm learning them now, and it's great to have a real life person to learn them on. Going to be having the practicals in March, and I'm setting them ahead of time. They're also very therapeutic and relaxing points, so I think it'll be a nice little acupressure massage for you too. So the first point we're going to start with is yin tang, which is right in the middle of the two eyebrows where they meet. And this is a great point for headaches, especially frontal headaches. It really helps to calm the mind, benefits the nose, and relieves any pain or tension in this area. And it can be used for insomnia, anxiety, as well as hypertension when it comes to sort of stress-induced hypertension. It can also be used for rhinorrhea, nasal discharge, and sinusitis. So a very good point that encompasses many different actions. The next point is called Yu Yao, which is the fish waist, and it is right at the center of each of the eyebrows. This point you might recognize as being part of the Yanbao Jiancao eye exercises, along with a few other points in the extra points actually that we will touch on as we go. And so understandably it's used for eye strain, really benefits the eyes. It also subdues liver yang and relieves any pain. Another interesting thing it can do is reducing eye twitching. So if you find that your eye kind of twitches, you can use this point to sort of allow the muscles to stop spasming as much. Okay. The next we have Taiyang, which I've used many times. This point is in the depression found 1 cun, posterior to the midpoint of the line drawn between the lateral end of the eyebrow and the outer canthus. So if you bring these two together and then go 1 cun posterior, right here. This point is great for headaches, especially headaches of the temple. Good for migraines, dizziness, poor vision. Overall, it benefits the eyes, reduces swelling, and relieves pain. The next point is qiuhou, which is on the inferior orbital border, so right here, and the meeting of the lateral quarter with the medial 3/4 of that border. So it's actually right here. And in the instructions, when you acupuncture this point, you actually want to push the eyeball slightly medially in order to acupuncture right under there. So I'm just going to locate this point without doing any acupressure on it. The next point is bitong, which you'll find the nasolabial groove right at the superior little border there. And this point really helps to open up the nose. It benefits the paranasal sinuses and relieves any pain in this area. So it can also be used for rhinitis, allergic rhinitis, even epistaxis, which is nosebleeds. So traditionally that wasn't an indication. And hopefully you can breathe a little bit easier now. Next we have jiachengjiang, which is grasping contain fluid. It is 1 cun lateral to CV24. CV24 is part of the conception vessel, and it's right here on the midline. So jiachengjiang is actually 1 cun lateral, and again I'm just going to use my thumb for a very rough measurement. And when we're measuring 1 cun, we're measuring at this interphalangeal joint here on my thumb. And me and my sister, we have around the same width of the thumb. But you also want to palpate for the depression, which is right here. You can kind of feel like you're just coming off a little piece of bone, and then right here. This point helps to benefit the face and relieves pain, removes obstructions. It can also be used for toothaches and swelling of the gums. Okay. The next point is 四身从. I hope I'm pronouncing that right, but it means form, mind, hearing. And first you're going to find governing vessel 20. So in order to do so, I'm just going to divide her hair right in the midline. Sorry. Place this right here. In order to find these 4 points, I'm going to divide the hair right down the center. And then we're going to find governing vessel 20, which you're going to use the apices of the ear and go up right here. And then you're going to use that thumb measurement again. 1 cun anterior, 1 cun posterior, 1 cun to either side. So I can feel that depression there. Now I'm going to feel on this side. Okay. We'll start with these 2 points, just kind of applying some acupressure. This point also subdues interior wind, calms the mind, benefits the eyes, benefits the ears, subdues liver yang. So you can see that the actions are very similar to governing vessel 20, which makes sense. They're all kind of in the same area. They can also be used for headache, dizziness, insomnia, especially if the insomnia is caused by anxiety. Okay, and then we're going to find those 2 points on the side, which is also part of the Shishan Cong. And the next point is arjian, and that just means the tip of the ear. And I can't really apply acupressure here. This is more like an acupuncture point, or maybe using a little thumbtack, ear tack, sorry. But this point will help to clear heat, subdue liver yang, and relieve any pain in this area. Next point is called Yiming. It means brilliant clouds. It's 1 Sun posterior to triple warmer 17. Triple warmer 17, I believe, is like right under the lowest point of the lobe here. And so if you're just going 1 Sun behind that, it'll be around here on the mastoid process. Let me just make sure I can find that little divot. It's directly posterior. This point benefits the eyes, benefits the ears, and interestingly also nourishes heart yin. You know, the heart yin is really important for sleep, actually. One of the causes of insomnia is heart yin deficiency. Heart yin is also important for just the overall well-functioning of the mind. And so if you have heart yin deficiency, you'll experience fatigue, as in all deficiencies, but also insomnia, anxiety, palpitations, that kind of thing. Okay. And then we have another point. I'm just going to turn your head slightly like this. We have another point called Anmian. And this point is at the midpoint of the line joining triple warmer 17 and gallbladder 20. We know that gallbladder 20 is back here. Let me just find it. Right here. So it'll be halfway between those 2 points. Right there. An An is kind of like safe, good kind of meaning, and then Mian means sleep. So An means a good night's sleep. Just here. And find that gallbladder 20 again, which is back here. Here, and find the midpoint. It feels like it's right behind the sternocleidomastoid. And like in the line. Okay. So that's it for the points of the face and skull. Next, we're going to move down to the shoulders and keep moving down to the lower part of the body. So next we have the point 肩内经, which means shoulder front, or 肩内经 or 肩内, oh, 肩内陵, 肩前. 肩前 means shoulder front. 肩内陵, I think, means the same thing. But this is at the midpoint of the line joining the end of the anterior axillary fold, which is right here, and large intestine 15. Large intestine 15, you'll find, I believe it's right here, right in this depression. Yeah. And then you'll find that at the midpoint. Is it sore at all here? Yeah. Okay. This is actually used for shoulder pain and stiffness. And helps to relieve pain in this area. Now we're going to move on to the arm. I'm just going to pull out your arm here. All right. The next point is called Arbeit, 2 whites. On the anterior aspect of the forearm, Vorzone proximal to the transverse wrist crease. So it's going to be 12 Zun between the transverse elbow crease, transverse cubital crease, and the transverse wrist crease. So if we're going to do Vorzone proximal, then we're going to have to divide this into 3. Like that. And it'll be right here. It's on both sides of the flexor carpi radialis tendon. Now, the radialis tendon is going to come all the way over to the thumb area. It's on the radial side. So it's going to be on either side of this tendon right here. So it's actually on the E of your let go tattoo. So I'll just mark that here and here. Well, not exactly on the E, but close to it. This helps to lift sinking qi. It raises yang and also treats hemorrhoids. Interesting. Then we're going to move on to the hand. The next point is sifeng. Well, there are actually 4 points, hence why sifeng, 4 cracks. This is on the palmar surface of the hand at the transverse creases, the proximal interphalangeal joints. So the proximal interphalangeal joints are these ones. So interesting. we're actually going to acupuncture here. Oh, prick does cause bleeding, so it's not going to be, you're not going to puncture all the way in, you're just going to prick it a little bit. And these are used to expel wind, harmonize the spleen, to resolve dampness. Traditionally, it's indicated for malnutrition and indigestion syndrome in children, as well as whooping cough. Yeah, I never would have thought that. Okay. I'm just going to mark that. Okay. And then we have the 十旋. These are on the tips of all 10 fingers, about 0.1 sun distal to the tip of the nail, so it's very, very close to the nail. And they actually include pericardium 9, which makes sense. Pericardium 9 is over here at the top. And these points are used to clear heat, expel wind, and promotes resuscitation. And again, we're just puncturing very, very, very shallow, only 0.1 to 0.2 in Suen, very superficial, or just pricking to cause bleeding there. Now we're going to turn the hand, and we have the 腰痛穴. The 腰痛穴, it means lumbar pain point, and they are found on the dorsum of the hand, midway between the transverse wrist crease, which is here, and the metacarpal phalangeal joints, which are here, the knuckles essentially, between the 2nd and 3rd and the 4th and 5th. So we're going to follow that, and it's going to be midway. So they're actually right here, and this is used for acute lumbar sprain. It benefits the lower back and relieves pain. So let me just mark that. Right here and right here. And when you're puncturing these, you want to make sure that you're looking for the vasculature and that you're not puncturing into any of the veins. So you can actually move the vein slightly and then puncture. And interestingly, it says here that it is recommended that the patient moves the lower back while the points are being stimulated. That's very interesting. Next we have luozhen, which means crick of the neck. This is on the dorsum of the hand between the 2nd and 3rd metacarpal. So it's here, about 0.5 sun proximal to the metacarpal phalangeal joint. So again, here's the metacarpal phalangeal joint, and we're going to be going just 0.5 sun, so half of the width of the thumb right over here. And this is used to benefit the neck, relieve pain, and expel exterior wind. I'm just going to mark that right there. Luozhen. And the next point is 八泄. So 8 pathogenic factors. It's on the dorsum of the hand when a loose fist is made. So can you just make a loose fist? Good. Just proximal to the webs of the fingers at the junction of the red and white skin. Now, red and white skin, it just means, depends on what the color of your skin is. But it's going to be where the color changes, essentially. So, okay. So it's in 3 places. That's my first time looking these points. And they're proximal to the webs of the fingers at the junctions. Okay. Okay, so it'll be right here. These points clear heat, expel damp and wind, moves blood, relieves swelling, and releases exterior. So these points can actually be used a lot for arthritic hands, so arthritis of the hands, redness and swelling of the dorsum of the hand, that kind of thing. Oh, there's also one over here. Did not know that. So another one right here at the web, at the junction of the red and white skin. Okay, and then we're going to flip you over so we can work on the back points. Okay, next we have Hua Tuo Jia Li. Hua Tuo's paravertebrals. That's what it's called. Let me make sure I have a little pencil. Running out of this pencil here. So these points are 0.5 twin lateral to the lower border of the spinous processes of the thoracic and lumbar vertebrae. Okay, so I'm just going to do the thoracic ones. And if it's 0.5 twin lateral to the lower border, we're starting at C7 actually. No. T1. Interesting. What about Dingtron? Okay. And Bailiao is 2 twin, so we're doing those later. So for you, I know that C7 is the most prominent one. This is C7, and then T1 is this one here, right below it. So if we're going to the lower border and going 0.5 twin lateral, we're doing half of a thumb. So around here, we're kind of on those paraspinals, kind of right next to the spinous processes. Sorry, the lower border of the spinous, the vertebra. And they're just going to be on either side. Yep. I'm just sticking to that lower border. Now the thoracic vertebrae are actually getting larger. So you're going to find that they're a little bit more spaced out, at least for you. It's a little more spaced out. Okay, and now it gets a little harder right there. Then here. And here. Okay, and then here. All right, so we have C7, T1, T2, T3, T4, T5, T6, T7, T8, T9, and T10. And we're just going to keep going all the way down to L5. And those would be the Hua Tuo Jia Li. And there's a group of 34 points on either side. These are used to regulate the corresponding internal organs. So I'm assuming over here would be more so the lungs and then we get to kind of the heart region, and then getting more so into kind of liver and spleen area, and then as you go lower, more kidneys and stomach, pancreas. Yeah, so these can be really helpful for that. Also benefits the back, benefits the spine, and relieves pain in this area. Okay. Then we also have Yi Shu and Hui Guan Xia Shu. These ones are lateral, 1.5 cun lateral to the posterior midline at the lower border of the 8th thoracic spinous process. So we said this one was the 10th, so 9 and 8, and usually T7 kind of corresponds roughly with the lower border of the scapula, but in this case that's actually, let me just count that one again. So we have C7, T1, T2, T3, T4, and that's T4 is kind of C7, T1, T2, T3, T4. Yeah, T4 is the large one on you. T5, T6, T7, T8, T8 right here. So the lower border follow the medial border of the scapula. This is 3 cun, so we're actually going to go halfway. So it'll be on either side here, right here. And these points are Yishu and or Wei Guan Xia Shu. It means the pancreas hollow. These are good for moving blood, clearing heat, and nourishing yin. So let me just mark that. 9, 10, yeah, so it'll be here. And that's that. Next point is Bai Lao, which means 100 taxations. Ooh, that doesn't sound fun. So this one is 2 cun superior and 1 cun lateral to the lower border of the 7th cervical spinous process. So we found it earlier. It's this big protruding one on you, and it's 2 cun superior, 1 cun lateral. Okay. 2 cun. Oops. So I'm actually going to use so this is 1 cun. I believe 2 cun is this, and 3 cun is that. Lower border. Okay, that makes sense. So here. And 1 cun lateral. So that's the midline. We're just gonna go a little bit lateral here. Okay, so right there. Gonna mark that. It's kind of where this line is. Oh, that's maybe a bit too far apart. I don't want it to be, yeah, that's too far. So let me just grab a bit of water. Okay. All right, let's try that one again. C7 lower border, 2 cun. Here, spinous process, kind of midline area, and then 1 cun on either side. So right here and right here. Okay, there we go. I'm a lot happier with that. And that is Bai Lao. Bai Lao. That makes more sense. And these points descend Leng Qi. Relieve coughing, resolves phlegm, and dissipates masses. The next point is Ding Chuan. Ding. I don't know how to pronounce that one. I am sorry. I have to look up the characters because just using the pinging, I don't know like which way I should pronounce it. but the translation is stopping asthma. And of course, you'd never use acupuncture to stop asthma, of course. You want to make sure that you're seeking medical attention, getting salbutamol and anything else that you need. But anyway, we need to learn this point, and it's more so for pain, relieving coughing, and expelling exterior wind. We're going to find that it's 0.5 Tsun lateral to the lower border of C7, so right here. There we go. So that is Ding Chuan. All right. The next point is called Yao Yan, which means lumbar eye. This point is 3.5 Tsun lateral to the posterior midline, which, is the spine, at the lower border of the spinous process of the fourth lumbar vertebrae. Alright. So now I actually have to find the fourth lumbar vertebrae. If you find the PSIS on either side, the iliac crest on either side, and then you move posterior, then you'll find L4, L5. So here we have to find L4, correct? Yes. Lower border of spinous process of L4, which is where my hand is right now, right between the two. And this point is found in the depression appearing in the prone position. So 3.5 Tsun. That means we're following the scapula. And then just going out a little bit. And then you'll find these little depressions right here. And it's actually on the ilium right here. So kind of like little dimples in your lower back. That's where that is. Yao Yan. These points benefit the lower back, relieve pain, and also benefit the bladder. Next we have Shi Qi Zhui Xia, which means 17th vertebra point. This is inferior to the spinous process of the fifth lumbar vertebrae. So we just found L4, L5 right here. And so inferior to the spinous process of the fifth lumbar vertebrae is down here. Right there. And this is a great point for benefiting the lower back, benefiting urination, relieving pain, but also regulating menses. So it can be used for irregular menses as well as dysmenorrhea, so menstrual pain. So that's that. Shi Qi Zhui Xia, 17th vertebra point. Okay, so that's it for the back points, and we're going to turn you around and move on to the leg area. All right, now we're moving on to the leg points. First we have Bai Chong Wo, actually means 100 insects burrow. Bai Chong Wo. 3 Tsun proximal to the medial-superior border. So medial-superior border, so around here, of the patella on the belly of the vastus medialis muscle. So this is kind of the vastus medialis, and we're going to go 3 Tsun proximal. So this is the medial superior border, and then we go 3 tsun superior. It'll be right here. Okay. Roughly. I would actually, to be more precise, I would use the full measurement of the leg. But at this point, I'm just going to make it, yeah, usually I would do here to here, 16, and then go. But yeah, this would suffice for now. And then we have Heding, which means crane summit. And this is in the depression on the midpoint of the superior patella border. So here's the little patella, and we're going right above it, right here. You know, the first time I knew that we could actually move this patella, I was like, wow, because it's literally just one small bone on top of the joint with some ligaments attached to it, and then the tendon of the quadriceps. The quadriceps tendon goes all the way down here and then attaches down there. So it's quite interesting. But anyway, it would be right here, Heding. And this point moves chi, relieves pain. It's used for knee pain, knee stiffness, weakness of the foot, and leg. Let's keep moving. Okay, we're almost done. The next points are xian. These are the eyes of the knee, and they're just the medial and lateral eyes. So you can actually see them right here. It's a little depression right here on either side. And here. And these points are often used for knee pain, especially pain in the anterior portion, and then down here as well. So it can expel wind dampness, relieve swelling, relieve pain, and dissipate cold. And next we have Lanwei Xue. Lanwei is the appendix, and Lanwei Xue is the appendix point. So this is a tender spot approximately 2 tsun inferior to stomach 36. 2 tsun inferior to stomach 36. Okay. Stomach 36 is... I actually forget where stomach 36 is. 1 second. It's been a little while. Stomach 36 to Sanli is 3 tsun distal to stomach 35. Okay. And this xian is actually the same as stomach 35. And from here to the this lateral malleolus, it's 16. So we're going to need to find 3 tsun lower. So let's go halfway, which is 8, and then another half, which is 4, and then about 2/3. Wait, no. 4. No, we divide it into half, and then another half. Does that make sense? 2, 3, yes. So this is stomach 36. I'm just going to mark that really quickly. And then Lanwei Xue is 2 tsun inferior to that. So if that's 3, one more time. 8, 4. So it's going to be 1 tsun lower than that. So around here. And it should be quite tender. Is that tender? Not really. No? Okay. Then I have the wrong point here. Okay. There we go. So that is Lanwei Xue. And it's used to relieve abdominal pain, clear heat, as well as resolving damp heat. Next, we have the gallbladder point, Dan Nang Xue. And this point is 1 to 2 cun inferior to gallbladder 34. Gallbladder 34, I just marked this again. We're actually going to find the fibula, the bone, the fibula. Okay, right here. And it's going to be right here in this depression, just below the head of the fibula. Let me make sure I'm getting that right. Yes, right here. And we're going to go approximately 1 to 2 cun, and we're going to find another tender spot. Okay. Let me find this. If it's only 1 to 2 cun, I don't need to go very far. Is this tender? Yeah. Okay. Right here. This is Dan Nang Xue. And finally, we're moving on to the feet, and that's it. Now we have the point Bafeng, 8 winds, and they are in between these webs, so in between the toes and the webs. And again, I believe, yes, they're at the intersection of the red and white skin, so where the skin color changes. So it's going to be right here, kind of like Ba Xie on the finger and the hands. This time we're doing Ba Feng. And these points are used for toe pain, redness and swelling of the dorsum of the foot, irregular menses, arthritis, and headache. Yeah, so you can kind of just press on them like this. And if you puncture them, you would go in obliquely about 0.5 to 1.0 inches. And that is it. Thank you so much for helping me today, and hope you have a good day.